Scope, Human Longevity and Performance Podcast. Visual acuity and longevity. Happy Halloween, everybody. I hope everybody's dressing up. My kids are being Spider-Man, Boba Fett, and a black cat. And I am going out as Darth Vader. If you're new to parenting, you're probably also realizing that candy is an alcohol equivalent for children, and they literally become drunk after several pieces of concentrated sugar. Sorry, Mormon Church. Concentrated sugar is a drug. Pew! But enough about candy. Today on Full Scope, we're going to talk about a very important longevity metric. Visual acuity, or how clearly a person can see things. For every longevity metric, we're going to look through three different lenses. The first lens is common sense. Does it make sense that a given metric would impact longevity? A clinical lens. Do I see evidence that a given metric impacts longevity in my clinical practice? And then finally, a research lens. Do research studies demonstrate that a metric impacts longevity? So, here we go. Starting with common sense. Sensing our environment accurately is extremely important for survival in both the pre-modern and the modern world. Imagine trying to avoid a saber-toothed tiger, or, since it's Halloween, an axe murderer without vision. For most people, vision is the primary human sensory organ. In fact, 30 to 50% of the brain is dedicated to processing visual information. So, from that standpoint, vision must be very important. Visual acuity is a measure of the sharpness or clarity of vision. Essentially, it's a measurement of how clearly we can see things in our environment. From a longevity standpoint, this passes the sniff test or the common sense test. Vision is obviously very important for finding food, avoiding predators, surviving attacks, building shelter, crafting tools, and more. In a modern environment, visual acuity is important for making social connections, building things, for many types of work, and even activities of daily living, things like cooking, cleaning, getting dressed, and etc. From this perspective, visual acuity seems tied to work, wealth generation, and independence, three variables that are strongly correlated with longevity. The social connection piece is huge as well. Similar to hearing loss, vision loss also increases the risk of dementia. Anything that prevents us from fully engaging with the world and other people likely increases dementia risk. Think everything from sedative medications or drugs to sensory loss to isolation. All right, so as a caveat, when vision is absent at birth or from an early age, people's brains and other sensory organs can compensate considerably. For instance, some humans can even use echolocation and have developed an almost spidey sense for understanding the world around them in the absence of vision. But when vision is gradually or suddenly lost later in life, compensation is much more challenging. Honestly, these two groups, people who lost vision at birth or didn't have vision at birth or lost it at an early age, and people who lost vision at a later age should probably be looked at separately with regard to how longevity is affected. But due to limited data, we are going to batch these two groups. But back to common sense. From a first principle, common sense logic standpoint, visual acuity seems very important for longevity. Pew! All right, what about from a clinical lens, the clinical approach? My clinical experience treating older, sicker people in the hospital, I've seen a lot of problems happen as vision impairment increases. I see a tremendous amount of falls in the elderly due to poor vision. Oftentimes these poor falls happen at night, in low light settings. So vision is tough with good light, but in poor light, humans get much worse at seeing things, and especially people with existing visual impairment. Injuries from these falls are often devastating and sometimes even fatal. Some studies even quote a 30 to 50% mortality within 6 months of a hip fracture from a ground level fall in an elderly person. And I have definitely seen that in my clinical practice. I have seen elderly patients fall, break a major bone, and that lead to a cascade of health issues and eventually their demise, sometimes quite rapidly. Vision loss causes many people to lose their independence as they can no longer perform activities of daily living. Things like getting dressed, doing laundry, cooking, cleaning, etc. And so as vision impairment increases, people can no longer take care of themselves at home. They lose their independence, and this often leads to additional health issues as well. And then finally, as people lose the ability to see, reading, crafting, building, and socializing gets much more difficult. Without these things, cognitive decline or brain function decline accelerates, and dementia often follows. So, from a clinical standpoint, loss of visual acuity negatively affects longevity in the patients I take care of regularly in my clinical practice. Okay, so from a common sense standpoint and a clinical standpoint, it looks pretty clear that a loss of visual acuity or impaired visual function decreases longevity. But what does the research show? What about research studies? How does visual acuity impact lifespan and mortality in clinical research studies? Well, the findings are consistent across multiple populations on multiple continents. Loss of visual acuity is significantly correlated with an increased risk of dying. The greater the vision loss, the greater the risk. Let's talk about 5 recent research studies that demonstrated this. Okay, the biggest one and the one I want to spend the most time on is the Ehrlich et al. 2021 Lancet study. It's a meta-analysis of 28 studies. It included almost 450,000 participants from 12 different countries. The study looked at how vision impairment affects all-cause mortality for people 40 years of age and older with a minimum of a 1-year follow-up, but sometimes greater than 10 years. Hazard ratios were calculated for all-cause mortality at different levels of impairment. And if you check out the blog, I actually have a table demonstrating this. But I want to do a few definitions first. So 20/20 vision is normal. And as visual acuity gets worse, the bottom number gets larger. At a visual acuity level of 2200 is usually what we define as legally blind. So 20/20 vision is normal. 2200 vision is legally blind. Okay, what is all-cause mortality? That's the overall rate of death from all causes. Hazard ratio, a measure of how a particular event, in this case death, happens in one group compared to another group over time. And so let's look at this study. So they looked at a vision level of greater than or equal to 20/40 and people who were better than 20/40. And the people who were worse or equal to 20/40 had a hazard ratio of 1.29, which means that the people with worse vision in that group had a 29% increased risk of dying compared to the group with better visual function. When we look at 20/60, that hazard ratio increased to 1.43. And then when we looked at 2200, that hazard ratio had increased to 1.89. So what does this study demonstrate? As vision impairment gets worse, all-cause mortality, or the chances of dying, increases. For vision equal to or worse than 20/40, all-cause mortality increased by 29%. And for those meeting criteria for legal blindness, all-cause mortality increased by 89%. Wow, those are some serious longevity metrics. Other recent studies confirm this result. Han et al., a 2022 study, showed that visual impairment increases death from injuries as well as cardiovascular disease. This study links visual impairment with heart disease, the biggest killer on the block. Those with moderate to severe visual impairment had a hazard ratio of 2.41 for cardiovascular mortality. That means they were 141% more likely to die. Wow. So vision impairment can also be a sign of badness in other organ systems, including the heart, blood vessels, and the brain. Okay, another study. The Verbeek et al. 2022 study showed that individuals with vision impairment scored lower on physical, cognitive, psychological, and social functioning. These vision impaired individuals had an accelerated deterioration of activities of daily living. And that's exactly what I see with my patients in the hospital. Mortality risk for severe visual impairment in this study was 1.89, exactly the same as the first study we mentioned, the Ehrlich et al. Study. So an 89% increased risk of dying from all causes. Christ et al., a 2014 study, and Siantar et al., a 2015 study, showed similar mortality or death risk for visual impairment as the above studies. So, we have multiple studies with diverse participants from different countries all showing the same thing. Vision impairment increases the risk of death. And as vision gets worse, risk increases. Pew. All right, how is visual acuity measured? Well, the most common way is with paper-based charts for far and near vision. Charts like the Logmar, Snellen, Tumbling E. At Longjetrix, we use the Logmar vision charts because this chart is considered the gold standard for visual acuity research. But there's other ways to measure visual acuity as well. There's virtual reality platforms. There's vision screeners like the devices you look into at the DMV. And in general, visual acuity is easy to measure. It's something a person can even monitor on their own if desired. So test this. It's not hard to test and it's really important. Okay, but why does testing matter? It's really simple. Because vision can be improved. Glasses and contact lenses can improve in visual acuity immediately. Procedures like LASIK, PRK, which is photorefractive keratectomy, artificial lenses, and etc., can literally cure visual impairment. In fact, just using your eyes and spending time outside can improve vision. In some studies, just putting up a Snellen chart in a classroom has been shown to improve visual acuity in children. Spending time outside is really important for eye function. Everybody should be outside for at least an hour a day, but ideally more. Natural light is very, very good for the eyes. Ever notice how bad your vision becomes when you stare into a screen for a few hours? Then how it resolves after just 15 minutes of being outside? It's amazing. Consider taking a walk outside every 1 to 2 hours if you work at a computer. Your eyes will thank you, and it will help other organ systems as well. There's also eye training protocols, most of which are digital, that have been shown to improve visual acuity. Many people have had amazing results from consistent eye training. So you can literally use your eyes and train them to get better, and there are programs and tools that people have built to help with that. And like most things in the body, the eyes must be used in order to maintain peak performance. Okay, so from a common sense lens, from a clinical lens, and from a research lens, we have alignment. Visual impairment increases a person's risk of dying. Therefore, visual acuity is an important metric to measure for longevity, one of the longevity metrics. So, don't accept vision loss. Measure your visual acuity regularly. If there is a deficit, fix it. Additionally, and importantly, consider checking for other health issues like heart disease and dementia, as visual impairment may also be a sign of other underlying health issues. If you want to see how we measure visual acuity at Longetrix, check out our YouTube channel, Longevity Metrics, at Bill Brandenburg, MD. Thanks again, everybody, and have a great day. Bye-bye. Thank you so much for listening to the Full Scope Podcast and Investing in Your Health. I'm Dr. Bill Brandenburg. If you're enjoying the content, please rate, review, and share this content with all of your friends online and on all your social media platforms. Please understand that this podcast is not intended to treat, diagnose, or cure your specific medical condition. This podcast does not create any type of doctor-patient relationship between myself, Dr. Brandenburg, and you, the listener. Be well, and thanks again for listening.